People living with bloodborne viruses are experiencing legal issues at many times the rate of the general population. There's no reason for this. It's unjust. This is not fair treatment, and the impacts on their wellbeing and healthcare are really significant as well. And there is nothing inherent in a virus or living with a disease that means that it should attract or create or generate legal problems, but there's something in the way we've arranged the law and the legal environment that's clearly targeting and providing a kind of differential experience for people living with these conditions. I'm David Carter. I'm a Scientia Associate Professor in the Faculty of Law and Justice at UNSW. I lead a research group called Health Plus Law. Health Plus Law is designed as a unique partnership across academic and community organisations to develop and deliver responses to the legal needs and experiences of community members living with or affected by HIV and hepatitis B. The aim of the whole study really was to take what community already understands about their own lives and experience and to try and connect it with what we understand as legal professionals and academics in terms of statutes and regulations and legal principles and systems. And when we find these things connect, we can see how the law is either helping or hindering people's daily life, their quality of life, their access to health services, and indeed their health outcomes overall. We've long understood or had an understanding about HIV in the law. It's been a story that's been developing since the emergence of the virus in the 1980s through successive waves. But people living with hepatitis B have never had an opportunity to have legal and academic research about the law, pay attention to their lives. There are, about 225,000 people living with hepatitis B in Australia. It's a very large group. And so this is the first time that legal research and legal analysis is really connecting with their stories and their challenges and their needs. Community members understand that the law causes them issues, and they want to understand how that happens and what can be done about it. And so our role as researchers and academics, my role particularly as a legal academic, is to try and connect their experience with the legal system and legal environment and deliver answers to the questions that they've brought to us. I think some of the big things that have come out of the study that shock me a bit are that the kinds of legal issues and problems and disputes that we might assume people living with a bloodborne virus would face, things like issues with healthcare, issues with health practitioners, discrimination, perhaps issues with criminal prosecution, they're all there, absolutely. But the surprising thing, I think, is that actually the law and the legal environment is causing really significant legal issues right across the spectrum of law and right across the spectrum of everyday life. I think so often we think about the law as this kind of thing that's out there, kind of distant away from us, that somehow magically appears in our lives and tells us what to do, I suppose. But for people living with the bloodborne virus, the law is a really everyday reality. It's about how they interact with their employer, because in the background they're wondering, am I going to be discriminated against? When they interact with a health practitioner or have to fill out a form in a hospital that asks about their status, they wonder, is this information going to be shared or leaked? Will I be treated differently? This is actually how the law works in people's everyday lives. If someone is coming to their clinician, doctor, nurse to talk about their health, that's fantastic. But if they're coming to them to talk about their health under the shadow of worrying about whether or not this might mean that they're going to create a legal issue, this means that no justice or fairness can be found here. But I couldn't do this work and my team couldn't do this work without the incredible generosity and dedication of people living with HIV and hepatitis B, their community organisations and all of the other people who work in and around that, from clinicians to lawyers and others. I hope that law is not only thought about always in negative terms, as a barrier or something that says no. It certainly does that a lot, but it can be something that we can, if we work together and collectively, it can be something that can be a tool for really positive change, not just in health, but in people's lives and their general well-being. That's what I hope people take away from Health Plus Law.